What is in a cigarette? Cigarettes are tobacco products created from thinly sliced and dried tobacco leaves packed in parchment paper that are rolled into tubes. It may also contain other substances, such as flavor enhancers. Cigarettes emit thousands of dangerous chemicals when burned. They can be toxic to both smokers and non-smokers in their close surroundings. Cigarette smoking can produce nicotine poisoning, leading to heart disease, stroke, lung disease, and many other health issues, including emphysema and chronic bronchitis. It can also cause malignancies of the lungs, larynx, mouth, esophagus, and neck malignancies, cancers of the kidney, bladder, pancreas, stomach, and cervix, and acute myeloid leukemia. Tobacco smoke contains thousands of compounds, including at least 70 cancer-causing agents. The substances that cause cancer are known as carcinogens. Tobacco smoke contains a variety of compounds, including nicotine. Nicotine is an alkaloid. This is an extremely powerful substance. It's the addictive drug that produces the effects in the brain that people are looking for. The Royal College of Physicians has confirmed that nicotine creates dependency as heroin and cocaine do. Nicotine is found in the tobacco leaf's moisture. It evaporates when the cigarette is ignited and attaches itself to tiny droplets in the tobacco smoke breathed by the smoker. It is swiftly absorbed into the body, arriving in the brain within 10 to 19 seconds. It activates the central nervous system immediately, which raises blood pressure and heart rate. This will cause demanding more oxygen for the heart. However, compared to other compounds in cigarette smoke, nicotine is safe. In trials, nicotine replacement treatment, NRT, has also proved not to cause cancer. When people are attempting to cut down or quit smoking, NRT can help them deal with cravings. It's available in a variety of forms, including patches, lozenges, and gum. Tar. When you inhale cigarette smoke, tar will be formed as a sticky brown material in your lungs. It might leave a yellow-brown stain on fingers and teeth. Cancer-causing substances can be found in tar. However, it has the potential to cause more than simply lung cancer. It also raises your chances of contracting other lung disorders. Emphysema and chronic obstructive pulmonary illness are examples of this. COPD. Carbon monoxide. All cigarette smoke contains carbon monoxide, the major dangerous chemical found in automobile exhaust. It binds to hemoglobin considerably more quickly than oxygen and leads in reducing the amount of oxygen carried by the blood. Extreme cigarette users' body's oxygen carrying capacity may be reduced by much more than as 15%. Hydrogen cyanide. This is one of the most dangerous substances contained in tobacco smoke. Hydrogen cyanide has been linked to a number of immediate and long-term harmful consequences of smoking cigarettes. Headaches, dizziness, weakness, nausea, and vomiting may occur after inhaling modest quantities of hydrogen cyanide. Larger doses might result in coughing, abnormal heartbeats, convulsions, unconsciousness, or even death. The severity of the symptoms is usually proportional to the degree of the exposure. Formaldehyde. The U.S. Environmental Protection Agency has categorized formaldehyde as a potential human carcinogen. It is a pesticide that is recognized in Canada. Its health consequences on smokers and others who are exposed to tobacco smoke can be severe. Tobacco products do not contain formaldehyde. When sugars, sorbitol, cork gum, cellulose fibers, and tobacco components like carob and gum are burnt, formaldehyde is created. When they smoke, they inhale it. Secondhand smokers consume it to a lesser extent. Irritations of the eyes, nose, and throat, as well as other breathing issues, are just a few of the symptoms of formaldehyde inhalation. Benzene. Benzene, which has been declared hazardous under the Canadian Environmental Protection Act, is considered harmful at any amount of exposure. The International Agency for Research on Cancer is classified as a Group 1 carcinogen. Toxic indicates that these compounds can be detrimental to tobacco utilizers, people who smoke, and those around smokers. It can cause sleepiness, dizziness, and headaches if breathed. The skin, eyes, and throat can all be irritated by benzene. Short-term benzene exposure can cause central nervous system depression and abnormal heart rhythm. Long-term, at least a year, benzene exposure has been linked to blood alterations. Lead and cadmium. Atmospheric consumption of lead, Pb, and cadmium, Cd, leads to poor neurodevelopmental outcomes, endocrine and immune system disturbance in kids, and an increased risk of cardiovascular disease and death in adulthood. Both elements seep from the soil into plant tissues and have been identified in dried tobacco at amounts of 0.4 to 12.2 grams per gram for Pb and 0.7 to 3.6 grams per gram for Cd. PB and CD become elements of secondhand cigarette smoke as tobacco is smoked. Arsenic. For smokers, the consequences of arsenic exposure are substantially more severe. Because cigarette smoke includes arsenic and smoking makes it difficult for the body to get rid of it before it destroys your cells, people who smoke cigarettes will suffer health problems related to arsenic. Lung, kidney, and bladder cancer, as well as heart disease, are linked to arsenic exposure and smoking. The simplest method to eliminate the source is to stop smoking and other tobacco products fully. Ammonia. Ammonia molecules aid in the absorption of nicotine into the body, making cigarettes more addictive. While ammonia is normally found in tobacco, radioactive elements, polonium-210 and lead-210. Most people are aware that tobacco and cigarette smoke includes a variety of hazardous compounds, such as tar, arsenic, nicotine, and cyanide. For generations, people have been aware of the consequences of smoking. Few people are aware that tobacco includes radioactive elements, such as polonium-210 and lead-210. Toxic and radioactive chemicals in cigarettes combine to damage smokers. People who really are vulnerable to secondhand smoke are also affected. Tobacco-specific nitrosamines. The carcinogens that smokers inhale, particularly tobacco-specific nitrosamines, are responsible for the causative link between tobacco smoking and a range of malignancies, TSNAs. Tobacco curing, processing, fermentation, and burning produce TSNAs, which are a kind of carcinogen. Cigarette tobacco, ambient tobacco smoke, smokeless tobacco, and other tobacco products, such as cigars, tumbak, and bidi cigarettes, have all been shown to contain them. Furthermore, due to the generation of TSNAs as regulated by the tobacco mix and curing methods, TSNA yields in tobacco smoke vary greatly in examined cigarettes from different areas of the world. Polycyclic aromatic hydrocarbons, PAHs. PAHs are a group of chemicals made up by two or more fused benzene rings that are known to be carcinogenic and mutagenic. In tobacco smoke, there are more than 500 distinct PAHs. Some PAHs are suspected or confirmed as human carcinogens, according to the International Agency for Research on Cancer, IARC. 1,3-butadiene. The World Health Organization, WHO, Study Committee on Tobacco Product Regulations, TABREG, chose 1,3-butadiene, BD, as a smoke ingredient that must be reduced. Chromium. Its side effects include nasal lining inflammation, runny nose, and respiratory issues, asthma, cough, and shortness of breath. Beryllium. It's carcinogenic to humans. A chronic granulomatous illness, berylliosis, is caused by continuous exposure to insoluble beryllium compounds, notably the oxides. It starts with a cough and chest discomfort. Most of the time, these symptoms progress to lung failure. Other side effects of beryllium exposure include heart enlargement, liver enlargement, and kidney stones. So that's all for today's video. If you made it this far, click the subscribe button and hit the bell icon for more awesome content. Thanks for watching!